Welcome everybody, my name is Joe Moore, nurse prac student. I'm going to be doing we're doing respiratory. I'm going to be doing a respiratory exam today. Alright, so this is going to be a respiratory video. This is my patient. Your name?
Lisa.
Alright, Lisa, you can call me Joe. There's our introduction. I'm going to knock on the door, I'm going to wash my hands. And while I'm doing that, I'm going to be talking to her, get my introduction out of the way, letting her know I'm a nurse prac student, and so forth. I've already checked your consent forms out in the hallway. Is that correct? You're here for a respiratory exam today?
Yes.
And you've given us consent?
Yes.
All right, so we have consent. Now we're going to start with inspection because we always do. Ooh, get back in here. We start with inspection because that's what we always start with, all right? And we would have her in a gown. I'm going to do anterior and posterior, and I'm going to be the one moving around a little bit as if this were a table. And so we're going to do her anterior inspection of the skin, scar tissue, lesions, masses, lumps, bumps, all that kind of thing. In her gown, we would be able to see this. But for our purposes today, we'll just do it verbally. And so we're going to check the skin out. We're going to have her lift her breast tissue up. We're going to have her lift this breast tissue up. We're going to look under the breast tissue and so forth. We're going to look at the thorax here and make sure that her skin is appropriate. While we're checking that skin, and we're going to come back to the back side, going to do the same thing back here, check all that skin appropriately. We're going to be looking for her respiratory rate and her effort. In her case, she's about 18 right now. And minimal effort, no accessory muscles. She's in no distress at all. And so we're going to move forward. If the inspection went well, we're going to move right on to palpation. And so we're going to palpate, costochondral. All right. Do you have any soreness?
No.
Is there any pain or anything where I'm touching? We're going to do this all the way through her lung field. Would you lift your breast tissue up out of the way, please? And the other side. And we're going to go through that. Do you have any soreness? Do you have any tenderness up there?
No.
We're going to do that on the back side too. So when we're palpating, we're going to go over that whole entire area. Do you have any pain or tenderness on the posterior side back here?
No.
Okay. We get that palpation done. We're going to move over to a percussion, all right? And so, all right, and once you set back, and we're just going to do this in the front, and then I'm going to have her spin around, and we're going to do it in the back so that the camera can see it a little bit better. We have a chair here, but it'll do. It'll do. And so on the front, before I do that, I'm going to go with some fremitus. And so every time I touch you, you say the word 99.
99. 99. 99. 99. 99. 99.
Lift your breast tissue up and out of the way.
99.
And the other side.
99.
Okay. And so the fremitus, we can feel it, but it's equal bilaterally, so it's okay. Now, when we're done with that, we're going to go to the auscultation. All right, we're going to use the diaphragm. We're going to go over the same spots. We're going to check all the lung fields. I'm going to start off with the supraclavicular area, the very apex of that lung. Let's go right up in here. Take a deep breath every time I touch you with this stethoscope. All right. We're going to use the ladder method and go down. Again, we'd be on the skin with a regular exam table and in an actual environment. All right, keep going. Take your hands and raise your breast tissue out of the way. Let's go here. All right, thank you. So the breath sounds, there's no wheezing, rales, rhonchi. There's nothing abnormal going on in there. Everything is resonant. Sounds pretty good, or excuse me, forgive me, vesicular. It sounds pretty good on that front. We're going to be doing it again in the same order on this back side. So now, let's turn that around. Ooh, okay. If you would, turn and face that way for me, okay? A little bit more. Okay. All right, this is her backside. All right, so we've done our inspection back here earlier. We've checked the skin. We know the skin is clear and clean. And now we're just going to move to the palpation. So we did that earlier. We checked up and down both sides. Paraspinal's in here. Everything, all this musculature. She had no pain or tenderness. And so we're going to move now to percussion. This is where we're going to do a couple little tests. So palpation is done, but again, before we do percussion, forgive me, I got to go back and do that fremitus. All right, every time I touch you, you say the word 99. I'm going to move the ponytail.
99.
Hold on. Okay, here you go.
99. 99. 99. 99. 99. 99. 99. 99.
I'm going to go out a little more.
99. 99.
Okay, that's fine. So when we're done with the palpatory, we'll go to the percussion. Now on this, can you see me? Yeah. Okay. On the percussion, right there. Thank you. Okay, so on our percussion here, we're going to look for diaphragmatic excursion. Now all that is the difference between when she's exhaling and inhaling. And so we're going to come around the 10th rib, go over here, get a little skin. Let me raise this up. We're going to go around the 10th, bring it in, right there. Take a deep breath, and out. She's equal, symmetrical, so the lungs are moving together on both sides. If one side's moving and the other's not, that's a problem. But we're looking for symmetry on that, okay? So I'm going to lower this back down. Now we're going to do some palpatory, some percussion. And I called that diaphragmatic. Forgive me. That is respiratory excursion. So what we're about to do is diaphragmatic. So I'm going to be palpating, auscultating. Okay, we would make a line about right here. All right, this is going to be the bottom of when she has exhaled, or forgive me, when she has inhaled, and then we're going to start it again. I want you to take a deep breath in. I want you to exhale it all the way out, and I want you to hold that.
Okay.
Okay, so go ahead, in, out, and hold it. We're going to start up top again, come down. All right, go ahead and breathe normally. What we're looking for is the difference between the inhalation on the bottom and the exhalation on the top. Now that number should be somewhere between 3 and 6 centimeters. And that's what we're looking for. We would just make a mark and you would look on both sides and make sure they're both equal. But for her, about 3 to 6 centimeters, our best guesstimate estimate, you know, for what we've got going here today. And that's about what she's got. So she's within normal limits. Your athletes, I had a couple of swimmers in my practice over the last 30 years. I've had a couple swimmers who've had like every bit of 8 centimeters. I mean, they had huge lung capacity. And so anyway, they can have, if they're well-conditioned athletes, they can be up there a little bit more, 7 or 8. And so right now, what we're going to do is auscultate just like we did the front. I'm going to use, not in the picture. I'm going to use the diaphragm. Every time I touch you, you just take a quick deep breath in and out, okay? We're going to go real high. Again, back here, getting to the top. Don't go too far over and get on that scapula. Don't want that. Okay, breathe normally for a minute. So check these lung fields. No rales, no rhonchi, no wheezes, nothing like that. Everything sounds pretty vesicular, All right, we're going to go around to these, especially the right side, and get on that middle lobe in that right lung. Give me a deep breath. All right, good. And give me another breath. Okay, so we went around the sides, and we've taken care of that. All right, I'm going to use the oscillatory method one more time. This is going to be a special test. You can do egophony and all these others. I'm going to use the, it's called whispered pectoriloquy. All right? And so I'm going to put this on her back. I want you to whisper 1, 2, 3. I can see her lips move, but I can't hear it in this, and that would be appropriate. There's no way for me to hear it. Now, if she had a bunch of consolidation in here, that sound and that vibration would come through, and I would hear her saying 1, 2, 3. So that's the whisper test, whisper pectoriloquy. And so, anyway, that's my thorax exam. I'm going to turn this in.